In our first community conversation, we're joined by Michael Vanhoy, an occupational therapist with UVA Health. He's sitting down with Aaron.
Nice to meet you, Michael, and thank you for coming in today.
You're welcome. Thank you for having me.
You are very welcome. So today we're talking about the UVA Health adult wheelchair clinic. So what led you and your colleagues to start this clinic?
Well, there hasn't been a dedicated adult wheelchair clinic in this area for a long time. So the push probably started within the Department of Physical Medicine and Rehabilitation, spread to several other departments, where they were seeing patients that were in need of either new or properly fitting wheelchairs, and they were having to refer them out of the area. So patients were either going to Richmond, going to Northern Virginia, before they could find a clinician with the specialty training in wheelchair evaluations. So we're also seeing that more and more insurance companies were, I guess in an effort to streamline their services and reduce their costs, were seeing patients with specialty complex seating issues and providing them with equipment that wasn't necessarily meeting their needs. So the medical center agreed that, in order to serve the patients in this community, that it was the right thing to do, to put a wheelchair clinic together.
Absolutely. And why is it so important to get patients fitted properly for their wheelchair?
Well, for most people in a wheelchair, it's their sole source of mobility. So if it's not fitting right, then they can't go where they need to go. They can't do what they need to do. And it's, there is no one size fits all with wheelchairs. And a couple of other key areas that we really focus on, one is comfort. So if you're not comfortable where you're sitting, you're going to get up and go somewhere else.
Right.
So a person in a wheelchair does not have that option. And then the other piece that we really try to focus on is preventing any additional complications or medical issues. So we're focusing on trying to make sure that they're not getting repetitive shoulder injuries, or they're not developing pressure sores or skin breakdown, or even if it's that we're not making any postural asymmetry worse.
And then what services do you provide at the clinic?
So we do evaluations for manual and power wheelchairs. We work directly with physicians and with medical equipment suppliers so that we make sure we've got the right documentation and the justification to go to insurance companies to get this equipment funded. Then we'll also do seating systems, so wheelchair cushions, backs, and that includes custom molded seating systems. We'll do pressure mapping for patients with skin breakdown or pressure sores. And then we'll also do general assistive technology evaluations for various equipment, things like standing frames or patient lifts, or even power add-on devices for manual wheelchairs.
That is wonderful. So quickly before we go, when and where is the wheelchair clinic?
It is at UVA Medical Center. It's in Fontaine Research Park. And it is open every day.
Wow, that's wonderful. Well, thank you so much, Michael, for coming in.
All right.
We'll see you next
You're welcome.
time.
All right. Thank you.
Steve?